we're covering the immediate and correct response to a patient experiencing syncope or fainting during a blood draw, a critical safety topic for your phlebotomy exam. Exam questions will test your ability to act decisively and in the correct sequence, prioritizing patient safety above all else. The most common exam trap is a question that asks for your very first action. If a patient shows signs of fainting, such as becoming pale or sweaty, or states they feel dizzy, you must immediately release the tourniquet and remove the needle. This action is the #1 priority to prevent injury from the needle if the patient loses consciousness. After securing the needle, your next step is to prevent a fall and improve blood flow to the brain. If the patient is in a phlebotomy chair, lower their head between their knees. If possible and safe, help them lie flat on their back and elevate their legs. Never draw blood from a patient sitting upright on an exam table without armrests, as this increases the risk of injury from a fall. Once the patient is in a safe position, you can apply a cold compress to their forehead or the back of their neck. While ammonia inhalants might be listed as an option on the exam, be very cautious. Current guidelines often discourage their use because they can cause respiratory distress, especially in patients with asthma. Your primary focus should be on positioning and basic care. A crucial point the exam will test is that you must never leave the patient alone. Call for assistance if needed, but stay with the patient. After they regain consciousness, they must remain under observation for at least 15 minutes to ensure they have fully recovered before being allowed to leave. This is a key safety standard. The exam also expects you to anticipate the risk. Be aware of high-risk indicators like a patient history of fainting during blood draws, visible anxiety, or fasting. For patients with a known history, it's best practice to perform the draw while they are in a recumbent or lying down position. Finally, meticulous documentation is mandatory. After the patient has recovered, you must document the entire event according to your facility's protocol, including the signs you observed, the actions you took, and the patient's response. To remember the sequence of your immediate actions, use the mnemonic STOP. Stop the draw and secure the needle. Tilt the patient or lower their head. Observe their condition and offer comfort, and prevent falls by staying with them. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.